Here's some simple tools to assess your metabolic health from home, which you might not be receiving from your practitioner. So the first one is actually subjective questions, and you'll see these here now. Simple questions like craving sweets and or carbohydrates, especially after meals, frequent thirst, feeling tired after meals, or blurred vision. So all of these symptoms can be, and that's important, it's not a perfect diagnostic, they can be indicative of poor blood sugar regulation. Now, anytime we talk about blood sugar, I like to use the roller coaster analogy. So what you want your blood sugar to be, as often as possible long term, is like the old wooden roller coaster that has some peaks, some valleys, but they're not as big and not as frequent. In comparison, what you do not want is the brand new roller coaster that has these great big peaks and great big valleys, and they have lots of them. So that would be blood glucose variability, that new roller coaster, and that is what you absolutely do not want. Okay, this is one of the most detrimental things for health, period. It increases our risk for chronic illness and just makes us feel miserable. The body does not like this. It's why it has mechanisms in place to bring that back down. So we're talking about symptoms we can ask ourselves or that we can assess about ourselves, which will actually give us some very valuable clues as to how our blood glucose is fluctuating. And so if you have these symptoms, you can just rate it on a scale of 0 to 3, 0 being never, 3 being daily, maybe even multiple times per day. So the more 2s and 3s you have, the greater the likelihood that this is something that you need to work on. Now, these symptoms are not random. They're actually based on your underlying physiology, and more specifically, your underlying biochemistry. So your biochemistry is changing, and that affects your physiology, and that's what you are experiencing as symptoms. The body is so incredibly intelligent. When things change, it's happening for a reason. I'll just give you one simple example. We'll talk about the sweets and or carbohydrates, especially after meals. So there's lots of research showing that the size of your postprandial, so after your meal, drop in blood sugar is actually associated with cravings and hunger. Now that's interesting, right? So if you feel this often after meals, that tells you that for different reasons, your blood sugar with that meal is going way, way up, and then it's plummeting. And that is triggering hunger and cravings. Now it's interesting, this is actually one of the reasons why restaurants will start you with simple carbohydrates, and that is to get a big hit of blood sugar to increase your appetite so that you're willing to eat more with that meal. So these are the symptoms. You want to use these symptoms. So what's next? Well, then we get to the blood work. Now, remember, if you don't have the blood work, not a big deal. You can use these symptoms. But many folks have blood work, especially as you get into your maybe early 30s, 40s, etc. Now, blood work is incredible. It's fascinating, right? It's like a snapshot of what's going on in your body. However, the problem, I would argue, and many others, is that in Western medicine, we just don't leverage it nearly enough. How many times have you or someone you know gone in, you're not feeling good, you get blood work, maybe they do 5 markers, 10 markers, and then it comes back and they say, everything looks normal, and they send you on your way. This is the problem, and there's a couple reasons for this. One is the ranges. So our ranges are way too lenient. That's because they're based on averages. Well, how is our average health nowadays? It's abysmal. And so these are actually adjusted over time. So you may be at a number that 10 years ago, 30 years ago, it'd be a red flag, but now because our average health is so bad, they just send you on your way. Now that sucks, but the good news is, yeah, we can act on this. So this is exactly why in health levels, I provide more appropriate ranges. Ranges that are tighter and will pick up on issues a lot sooner. And all of these ranges are based on science. And I provide every single reference in health levels so that you can confirm this if you want. But just to show that, yeah, there is research to show that this level of glucose or this HbA1c or this insulin, even though you're in the healthy range, if you look at the science, it's actually not good for your health.